Good
Hey
morning
everyone.
from the from the West Coast at least. It's
Angela, we
not
were
morning
waiting on you.
anywhere.
I'm so sorry.
Hello.
I'm ready to watch the show. Hey,
I,
everybody. This is Angela Love Zarenka from Lactation Education Resources. I'm just so enthralled and excited and enthusiastic. There's three E words right there to welcome Nikisha Killings, Nikki Hunter Greenaway, and our guest today, Jabina Coleman. I will let them go ahead and introduce themselves. We are recording this webinar, so thank you all very much for joining us today to hear more about healthcare self-care, how lactation professionals can take care of themselves while taking care of families.
Good
Thank you,
morning.
Angela.
I am Nikisha Killings.
Hello.
So we're trying to get Jabina's audio so she can participate with us here. She's having just a little technical difficulties. We apologize for the delay, but we are here and ready to roll. So I am, like I said, Nikisha Killings out front in Los Angeles. And oh wait, you in? She's in? She's
Yeah.
in? Okay. I am one half of Nikki and Nikki Lactation Career Consultants and private practice lactation consultant in South Los Angeles, providing support to the community and director of equity and inclusion at Lactation Education Resources. Shout out to LER for making this possible. All right, Nikki.
Hey, I'm Nikki Greenaway, also known as Nurse Nikki. I'm a family nurse practitioner in IBCLC and private practice in New Orleans, Louisiana. I am the other half, the other Nikki, and Nikki. And I'm so excited to do this again, do this for another week. I think we're getting some good information out, and thank y'all so much for showing up. I know it's a stressful time, so we appreciate y'all. And Jabina.
Oh, hi, everyone. My name is Nikki Coleman. I am a lactation consultant and a licensed social worker. I wear many hats. I work in the hospital setting as a social worker, but do private practice work, supporting moms and babies and facilitating folks, lactation folks, looking at perinatal mood and anxiety disorders.
That's a lot.
Yeah.
That's why we called you.
Jabina is,
That's why we called you.
yeah, exactly. She's the perfect person to be with us today. And she's why, all of that is why she's with us, because we want to talk about how to take care of ourselves while we're out here taking care of everybody else.
Mm-hmm.
We want to do first, what we'd like to do first is just, check in. How are you all doing at week, whatever number this is of the plague? How are you all doing?
The plague, not the plague.
I mean, is it not a plague?
Right. It's something. And I would say that I think as we chatted a little bit about it yesterday, is that I'm spent. Like I'm so over this. As I know, we're in Louisiana, and Louisiana's been hit really hard with it. And I was talking to folks, and like, you know what? Like, I'm not, those memes that are going around saying that if you don't use this time, you don't lack time, to do something innovative and creative and start these new businesses and new ideas, then you lack discipline. And I was like, no, that's just common sense for me to rest my mind. This is a traumatic time. This is a huge shift for families, for communities, for the entire world. And everybody's inside. So we just take that time to like, okay, this ain't nothing. We're not about to do anything new. We're about to deal with what we have, find a rhythm of some sort, find some normalcy for the kids so they don't see that this being a traumatic thing. But also for my practice, I'm like, I'm not about to wheel out something new in the midst of a pandemic. Like, I don't have the capacity to do that right now, mentally or physically. And I'm a home visitor. Like, I do home visits, that house calls. That is my jam. My jam is not being on the phone all day. I enjoy talking to y'all on Q&A, but
Yeah.
I'm zoomed out for the rest of the week. Like, I don't want to do the more Zoom. So So this is where I am right now. So that's where my mental space is right now.
Mhm.
Yeah, I'm in a similar space. I think I shared last week that we've been home about a month now, so add a week to that. And while we, are enjoying the family time, it is not downtime. I was telling a friend last night, everybody else is like, oh, I'm catching up on all my Netflix shows, and I've seen all of Netflix, and I'm like, how? This is probably the busiest season I've been in so long a time, and that it can become overwhelming. Like you said, Angela and I are on Zooms. We see each other like 5 times a day, various meetings, webcast meetings, and that each one taking a lot of energy out of you, right? So I'm exhausted by the end of the day and still need to do something to support families. And so there's kind of no end to it, and it disrupts your sleep because you have so much going on, and accompany that with the fact that there is a pandemic going on, and people are impacted by it, and businesses
Right.
when your community is hurting. It's a lot. And I know you all out there can relate to it. Los Angeles had really California did a great job of getting ahead of the curve, and so the last few days they were celebrating kind of a slow down in the death toll, which is just language that doesn't even, how can you even celebrate those words, right? Um, so there's been some incremental wins, but they're saying they need everybody to just stay home over the next week, because this is kind of where we're supposed to peak. And so if you just make those groceries stretch, do whatever you can, just don't leave home over the next week so that we can get ahead of this thing. And that in itself is a really stressful predicament to be in, and you think about those folks who don't have that as an option. So
Right.
there's a lot that I'm carrying, that we're carrying, and yeah, that's where I am. Yeah, Jabina, how are you?
Yeah. Whew. Where am I? I think I am in a very different space today than I was even yesterday. Honestly, today I woke up a little bit more anxious about,
Mhm.
and I don't know where the anxiety is coming from, but I did wake up a little bit more anxious this morning, so tried to kind of get in a little routine. Um, I've been home now. This is week 4, and so um, I do have somewhat of a routine, but those first 2 weeks, I really had to just kind of like shut my doors and focus on me, myself, and family and my children, and like think about just the resources that we're going to need to survive. I just kind of kicked into that protective mode, and it was a little bit hard. Like there was like this huge struggle between like, do I support my community and like my work, or do I take care of myself? Like, right. So I see everyone was online and, talking about all of the things and policies and this and that. And I could not get into it. Simply because I just had to like really focus and say like, what's important right now. And then I had days of like, maybe I'm not doing what I'm supposed to be doing. I should be on the front lines. I should be more verbal and active, but I just couldn't. And so, yeah, really over the last couple of weeks. And then today I just kind of was struck with a little bit more anxiety. I get all the updates from the hospital. So I know exactly how many cases are at my hospital. I know how many folks are on ventilators and like all of those things. And it has hit home. Have 2 aunts that are struggling with COVID right now. And so, and a friend who passed away from it. And so a high school friend. So it's and if we're at the peak, I'm like, I just did grocery shopping, and Instacart right now isn't, they have no orders available in my area. So I'm just like, okay, like, am I going to be forced to go outside? And it is 70 degrees out today. So it's just kind of like, no, there's going to be a lot of people outside today. So I really don't want to go outside because the weather is so nice. So really just trying to find this medium and just being kind to myself and just being gracious and just taking it a minute and a moment at a time. So that's kind of where I've been, so yeah.
So it
Yeah,
sounds
that's
like
all
Jabina has
real.
been able to do the thing that I haven't. But
Which was,
let's talk about. let's explore that a bit. She says that she took the first couple of weeks when everything was just, first hitting, and all of us were like, oh my gosh, I got to get into telehealth mode. I got to start helping families a different way. She took those first couple of weeks and was like, stop, pause. I got to check in on me
Right.
and make sure I'm okay. Yeah. How did you do that? And can we do that now?
Yeah, it was like this real internal struggle, because there was a point where I felt like, am I being selfish? But how did I do that? It wasn't easy. It wasn't easy because I had a lot of internal dialogue about it. But I think now, as I encourage other folks, I'm like, you can do this. This is your health as well. This is your family. Yes, our clients are, and yes, our work is important. But if we're not well, whether it's emotionally, physically well, we're not going to be able to do our job of supporting clients to the best of our abilities. And so I think that it's really important for us to measure that. And I would have been no good. Like, I would have been trying to set up this whole system. I think, Nikki, you said that, right? I would have tried to set up this whole entire system of trying to get everything and up to speed, and it would not have been best for me. And I wouldn't have been able to provide adequate services. And so I think that just coming to terms with it. And I think by midweek 2, I was just like, you know what? I'm okay with this. I am so grateful for my circumstance. And even us as professionals, everyone isn't in the same position. And so for me, I am working from home. I'm able to still receive a paycheck. And everyone is not in that same position, in that same boat. So I kind of wrote different mantras and just different things that I was grateful for and thankful for to kind of keep me focused. And every day I just wake up and I'm like, I'm just so grateful for my position. I'm so grateful that I'm still able to have an income, still able to have a space that I'm comfortable in, and that my kids are comfortable in, and that we have access to food and things like that. So really putting it into perspective. The other question was, can folks do this now? I think for many of you who have jumped right in and was just like, I'm out here, we're supporting our families, kudos to you. My hat goes off to you. And I say a huge thank you for really upholding the community and being on the front line while I was taking a break. But at this juncture, now we can switch. We can switch roles and give yourself permission to really just sit back. And I think once you sit in it and you allow yourself to be like, I know I'm purposely and I'm intentionally doing this, you're going to feel better about it. You're really going to be able to appreciate those moments of quiet time, whatever it is, or lack of screen time, or just not feeling the pressure of having to follow up on a consult and respond to a client or something like that. So, and I'm energized. I could jump in, I can be like, what is it that I need to do? Black Maternal Health Week is coming up. So I'm fired up, I'm ready to go. And I, encourage all of you folks who've been out here on the front lines doing the work. Now, if this is your time of respite that you need, I think it's, if I can give anyone permission, I'm giving you permission right now to do it, to really do it.
I take it. Thank you.
Yeah. I receive that. Thank you. On that note, I'm logging off, and
I know. We both were like, dude.
I kid. That no, you brought up a lot of good points. And sorry, Nikki, I know you probably have so much to say too, but I put a pin in this one place. Yesterday I got a message, and it was, dire, and it was, hey, there's this family who's really having a super tough time getting baby latch. They tried virtual, it's not going to work. Who can go see them? And it was to a couple of local folks. And I was thinking, oh wow, first thought was, I really want to help. Second thought was, I can't. I can't. I'm not in a position where I can go out and see families right now. I don't have any PPE, right? That's not a thing that I'm set up for in this moment, and they don't want virtual support. They've had it didn't work. They want somebody to visit them. So then a couple of folks stepped forward and said they could go, and I was thinking, who is seeing families right now in the middle of the pandemic? Who's going in person? Why are you volunteering? And I had to think for a second. Some of us still need to do that to put food on the table. Some of us are having to still go out, So we've talked about telehealth, and it's a wonderful, beautiful thing. It was what our first session was about. And we're supporting families. We're able to support families virtually. Some of us are, but that in itself may be a position of privilege, right? So there are colleagues of ours who have to still go out and put themselves in these dangerous positions, because this is how they are feeding their families. And I want to respect that, right? And not judge anyone for having to make those types of tough decisions, but really hope they have the PPE and the ways to protect themselves as much as possible in visiting families still. You said, Jabina, it's a blessing and a privilege to be able to say, I'm not going to go see families right now. And, I'm going to see them a different way and serve them a different way. But also, if you have the ability to pull back and say, I'm going to pause and see if I'm okay, because I can't support people if I'm working from an empty well, right?
Right.
Then what we're recommending is that you do that thing too, that you take care of you too in this moment. What do you think, Nikki?
Right. I wonder if we got the same message, because I got a message yesterday, a text message from the hospital, actually, from a OB, and was like, "Hey, Nurse Nikki, yeah, so are you doing home visits? I have a friend that's really, having a struggle with breastfeeding." And I was like, no, I'm doing telehealth. And she's like, oh no, she tried the Zoom. She's not working. Zoom is not working for her. And I had to think about it. I was like, this is the OB that I would like a relationship with, and we've been talking back and forth for a couple of weeks on a COVID patient that we've been working on. Never worked with her before. And I was like, do I need this in order to validate myself with her, to say that, and then I was like, but you don't though. You don't, because you don't need to be out here in these streets. We in New Orleans, right? This stuff is crazy here. I was like, I don't really need to be going out like that. And I'm trying my best to, not to. If I haven't gone to the shelter to do it, I'm not about to go over here to try and impress this doctor over here. So nobody's getting home visits right now. And we're going to do the best that we can from the inside of our home. Now I said, there is a list of people that are still doing home visits. So I sent her that list, and it was, like a very dry, thanks. And I'm like, I'm sorry. I can't, I have 3 small children, and I have a partner that's still working, 50, 60 hours a week. But then at the end of the day, I didn't actually really need to give you that explanation. I didn't owe you any of that.
No, would have been fine. Yeah.
Right. No, would have been fine. But I felt like, I was like, I need to tell her why I can't do it, because I'm really committed. And it's not showing that I'm not committed to this work, because I know that I am. I have bags under my eyes and exhaustion from knowing that I'm committed to this work. I'm on the phone multiple times a day in the wee hours of the night doing, random text messages with my patients. So it's not that I'm not committed, but at this time, I was the person that when this hit March 13th or whenever that was, it was Friday the 13th, when they were like, the school's out, we have to do this. It, turned around I need to pivot. And I think I may have pivoted too fast and hurt myself.
Yeah.
In the long run, oh, you pivoted too fast. You tried to do all these things. When you Nikki, you've always been committed to home visits. That is your jam. Stick to that. Help do what you can. But now, once I pivoted and tried to update the website, do all these things, contacted the biller, how do I do this? All this stuff. I was exhausted. I was going 3 days, and I called Nikki 3 days of no sleep. My body started to break down. I was like, I can't help anybody in this state. I didn't know who I was responding to on text messages. That's not the Nurse Nikki that you need. That's not the Nurse Nikki that my community needs. And yes, I'm blessed, and it is a privilege to be home and be able to be with my children. When I know that there are people at the hospital, my colleagues who I work side by side every day are at the hospital now because that's what they have to do. And I'm praying for them and whatever I can do on the community. But I feel like my space is on the community because there are people leaving the hospital that still need care outside of here. So while I felt guilty at the beginning, I'm like, no, your space has always been outpatient. There's plenty of need outpatient. So just do what you've been doing, but
right.
I am looking forward to the day where I can go and do some home visits and get back out there and doing it. But right now, my time, my space, this is what I'm supposed to be doing right here at this house.
Mm-hmm. And I think, Nikki, you brought up a good point about pivoting during this time. So when we also have to be mindful that when we're pivoting, you need to be able to have an anchor. You need support around you, right? And you can't just like, I'm gonna just get up and pivot, right? You just
That's exactly what I did. Got up.
Just ran, started running.
So, exactly. You have to be able to have a village, have a community, have things in place so that you don't burn yourself out, you don't hurt yourself in the process. And I think that if we, sometimes it's more instinctual for us, right? Because we're in the helping profession. So it's just an instinct that we're just going to be like, I just want to help. This is what I'm going to do. I'm on the front line, but we have to be mindful of that process, right? And so what are the steps that it's going to take for us to really pivot and pivot appropriately so that we're, again, not burning ourselves out and not hurting ourselves in the process.
I love that.
Very true.
So there's a thing that my kids and I have been doing forever. And on Wednesdays, it's called Wonder Woman Wednesday, where we just kind of feed back into ourselves and we do whatever it takes to feel really strong and empowered, right, as women. And so I feel like this is another way to really feed back into and make me feel empowered. And it doesn't have to look like grinding my gears, working so hard, sweating, Another way to feel really powerful in this moment is to listen to me and honor what my body is saying it needs and what I need as a person to really be whole enough to help you on Thursday, right? So I'm declaring Wonder Woman Wednesday, Superman Wednesday, Invincible Individual Wednesday for everyone that's on the call. Do what you stop grinding your gears, stop having smoke, come out of your ears and from your feet from running and pedaling so hard. Take a moment to honor yourself in a way that really just feeds you so that you can be a better support when you're ready to go back out there, right? Are there any practical tips, Ms. Coleman, that you can give us? What does that look like?
Yeah, and I love the Wonder Woman Wednesdays. I wrote it down. I think that for all of us individually, it's going to look different. And this gives us the opportunity to think about like what works for us. What are our coping mechanisms? And what's coming up for us? And for many folks, it could just be different things. And so for me, I just use making my space a safe space sense, right? So burning my candles, and for me with setting in a routine. That means I have to wake up and take a shower at 7 a.m. while the kids are still asleep. And for some folks, I know this is a blessing for me, but my daughter is not an early riser. So 9 o'clock, she'll still be asleep. And if you allow her to sleep until 10 o'clock, she will. But, so I putting in a routine for myself has been helpful in eating, right? And so making sure that first you're taking care of self, you're taking care of your body, taking care of just your daily necessities, and making sure that we are eating, because I've had days where I fed the kids and didn't feed myself. And so making sure that one, you have the time to kind of get your own little ritual in. We do a dance break in my house. So I'll turn the music on 100. Yes, we put Pandora up on 100 on the TV and we'll do a dance break. And I try to get at least 3 in per day. So that means we'll dance to one whole song, and that's like 3 minutes. And then it just turns it right off. As soon as the song's done, that's it. And everybody kind of goes back into their, their groove of whatever it is that they're doing, whether it was watching TV, finishing an assignment, or something like that. Right. So really see what works for you as an individual. And I think that, finding that a craft. So I've been coloring. I've had, now I got things posted all over the refrigerator because I've done the adult coloring books. And while my daughter is coloring, we planted a plant. It still hasn't like budded yet, but I don't have a green thumb. Just trying new things. And then from a health and wellness perspective, I think that, really sitting with yourself and journaling, that might be helpful for many. Getting in some form of like exercise routine, and because we have to be confined to our home, like my first day of doing exercise, I woke up the next day and was like, oh my gosh, I hope I don't have COVID because my entire body hurts. Like, and I had no idea. I had just did like 50 jumping jacks. I tried to do a push-up challenge that just didn't go. That didn't work. You know, so I was physically trying to put myself and like just be active. And the next day I was so sore, and I didn't put two and two together to be like, oh wait, I was trying to work out. But really trying to find these routines, find this space where you can just find some enlightenment and joy, and that just takes your mind off of like all of the hustle and bustle and the things that's happening on the news. Decrease screen time as much as you can. I think yesterday I was also over screen time because I was on the screen. I had screen time for about 5 hours straight, different calls, back to back. So trying to eliminate that, which is hard because if you're still working, everything is virtual. And be intentional. I've been intentional about putting my phone aside and really just being present in the home at this moment. And so I think finding those ways that are going to just support your daily routine and your family. For folks who struggle emotionally with mental health diagnoses, I think that it's also very important that as professionals, you take care of yourself, right? So if it is medication, if it is, you know, talking with your therapist, finding that support system, that village that you need, try to, you know, stay in those routines, try to stay in those habits as much as you can, to kind of help ground yourself. And again, Nikki, you mentioned it earlier, that meme that's going around of not trying to start anything new, being okay with that. We're in a pandemic because we are, and a lot of things are out of our control. And so, you know, yeah. So those are some tips
that in itself can be traumatic. Yeah, no, sorry to cut you off. That in itself, like being in a pandemic, brings some level of trauma to us, right? And so we have to know that this is a thing we're going to have to heal from when it's over, and not try to do too much in the moment. I think is really key.
Yeah.
Angela says we've got questions, so we're ready. What you got, Angela?
Yeah.
So there's a lot of emotion in the questions today, as you're smiling right now. But so basically, there's a physician and a lactation consultant who is talking about a hands-on consult and how to protect yourselves. So that practical stuff first. I'll give you the easy one first.
Yeah, Angela, do you have the? Let's see. I think there was this covered on one of the handouts we shared before a little bit, or was it? I'm trying to think.
It is. But I think that,
you
know, this is one of them. But I also think if there's anything that's new out there that you've seen as far as how to protect yourselves, that would be helpful.
Yeah, of course. I just want to make sure the handout's available.
That came up in one of the IBCOC groups about, hey, are y'all wearing masks when you're doing hands-on lactation support? And all of the lactation consultants in the group were saying yes, they're absolutely all wearing masks. If they're COVID positive, then they're wearing the N95 mask, but just a mask in general, and then wearing gloves. So I know that has been a thing. They haven't said anything about gowns. They said that wasn't, you know, they didn't feel that was necessary at the time. But also, and we talked about it last week in ways in which you can do this from a different way of maybe having a doll with you and mimicking, you know, showing, demonstrating exactly how that works. So that would be helpful. But wearing a mask is key, and wearing gloves, but also making sure that you dispose of your gloves each time that you're doing it. So I don't think there are any new guidelines. I think now it's just like, what do you have in your space?
Okay, that's good.
Yeah, that was part of, Jada shared that last week with us from her experience working in hospital with families still. So nothing's really changed on that protocol. We talked about, you know, like Nikki said, making sure that we're modeling in a way that they, you know, can copy and do the same movements without having to actually make contact, if at all possible. And then also keeping a distance that, you know, is respectful, but is also effective and impactful in what you're sharing with them.
Yeah, and I think also engaging the parent as much as you can. So instead of, you know, engaging and educating at the same time, so things that you would typically do, have them do, and ask them questions around like what they see and what they feel and things like that, I think are really helpful to kind of keep that distance for the contact.
Excellent. Okay. So then we've got a lactation consultant who's on a maternity unit and parents are going home at 24 hours. This person's feeling a lot of pressure to help families to be prepared to take their babies home. And she says that she's getting text and phone calls from patients at all hours of the day and night. How would you address that?
Do they have one thing that's been happening at our hospitals as well? Here is, do they have a list of people that are offering virtual services in their community? I think that would be really important, to kind of who have they worked with in the past, or just put a call out, on Facebook or whatever, like who's doing virtual in our community. And I feel like Lydia in LA was working, like she connected you and I, Nikki, to some group that says virtual lactation support, and it's all over the United States.
Yes.
And there is a group called Virtual Lactation Support, so you can tap into that. But finding out who her community folks are, this time right here that we're experiencing is really going to show how our hospitals and our outpatient and community services all work together, and how we're all working
Yes.
together. Because there's no way we can get through this, and if we don't work together, there's no way.
Absolutely.
Because the hospitals don't have capacity to provide any outpatient or any extender services into the community. They are bringing all their resources in inpatient. So we really have to tap into our community, use us, like we are here, and a lot of us want the work and want that interaction. So I think it would be key to kind of tap into, see like who's in the community doing this work, to take the pressure off you, because you probably have other things that are weighing you down that that are really pressing on you as well.
Yeah, I would say from a personal note, I came into this work as a volunteer peer supporter. And in that work, your phone number is published and families call you all night. And you make yourself available to them. That was draining in a normal time. That was draining at a time where I didn't have my kids all day and my partner in the house, and trying to juggle all these things and live in a time of a pandemic. So I can't imagine what you must feel like getting those types of calls all night right now. So like Jabina said, I want to give you permission to log off, to have some set hours, establish some boundaries, and create a window that's just for you, to take care of you, to sleep, to eat, whatever you want. Create that window where you will not accept other outside questions, please, issues for you to address. It's really important that you set that time aside. And like Nikki said, it'd be great to offer up here's some other resources you can contact between midnight and 6 a.m.
I
Here's
think
some
that's
other resources that
important.
are available. Yeah.
I think definitely having like the virtual lactation support, and just like I know in our hospital, there's just a list. Here are these resources. So Nurse Family Partnership is still accepting clients, and WIC and Healthy Start, and so being able to connect them with other folks who have lactation peer support, to answer those questions, and to maybe there are folks who are answering questions at midnight and in the wee hours of the morning. And so I think that
it helps if they're in a different time zone. Yeah, right. So it's not so late for me to answer you all's midnight calls. Yeah.
Yep. So getting that list together might be helpful.
That's a great point. I think I hope that's helpful to the person asking that question. Angela, is there anything else?
There is. It's interesting though. There's someone who asked this really deep question, but then they're also chatting with me and giving a really good idea. So one thing that she is doing, so she works in a hospital, and she says one thing she's doing as a team is using essential oils on the corners of our masks. We have to double up, specifically breathe from doTERRA, and that's really helped all of us. So putting a little essential oil to help them to breathe and to take a moment is really helpful. And the same person is asking, though, really this transition from hospital to home. So they're working in a hospital and it's just incredibly stressful. They feel like they're living two lives. In the hospital, there's all this separation of the parent and the baby, and there's so much formula. And the concept of, quote, this is the least of our worries, which is just so distressing to this person. And it's exacerbated by differing views of the severity of this situation from a leadership perspective, even now, which inevitably will influence the readiness and the policy. So they're seeing this sort of disintegration of the practices. I know this person works in a baby-friendly, environment where it is a priority, and yet when, push comes to shove and things are getting stressful, it all seems like it's reverting back to. And it's really sad that it is the parents and it is the babies who are suffering from this. So how do you deal with all that?
Mm.
Well, I want to first say that we're all dealing with that. And I don't know that we have answers for it yet. It just really is the reality of the situation. And you've got to, so hopefully I hope it helps to know that you are not alone, that all over the country, all over the world, lactation supporters are feeling the same thing from the institutions that within which we work. I think it's okay to be really, really upset about this and to understand the gravity of it more than everybody else around you. It is what it is. We're going to be feeling the ripple effects of this for years to come. And we're able to see this in a way that other folks can't quite see it yet, right? There will be glaring dips in breastfeeding initiation rates and, 3-month rate, all the rates will be impacted by this time that we're in right now. And we can see that coming, but nobody else around us can see that coming because their energy is focused on saving lives that are impacted by coronavirus right now. We understand that. We know their work is also really heavy, and they're not, I don't think, intentionally slighting lactation, but it's going to be a side effect of kind of where we are. So just understanding that you are in a place that all of us can respect and understand and empathize with, and we have to get to the other side of this whole, right? We cannot let this thing eat us up in the way that we're no good on the other side of it once it's, because coronavirus won't be here forever, right? And when it's over, we have to be around to pick up the pieces and make sure that we help to right this ship that's going a little bit off track right now.
Right.
What do
And
you
I
really
think
think?
it's important. I also think it's important to realize that you don't have to have answers right away and right now. And we don't have to fix it, right? Because where we are, especially being in the hospital, we have to kind of ride the wave a little bit, knowing, as you said, Nikki, like that their focus is on keeping people alive, the folks who are impacted the most with COVID, and so I think that with the work that we do, we are going to see a shift in all of those things. Initiation, inclusivity, longevity, we'll see those things. This is going to inform policy, and it's unfortunate that that folks are pushing formula right now, but that the lens of that is, it might come back to say, I don't know, that this is why formula is needed. This is why formula is needed in situations where there is a pandemic, and if it is contraindicated, which we know that it isn't for moms to be nursing. But I think that right now we can just gather as much information as we can get, kind of document these feelings, document these things that we're hearing, and use this information and use this stuff to inform the next few months when we're all back and running. And I'm hoping that it doesn't last longer, than it needs to, so that we can move forward collectively. So, yeah, I don't know if you have any other thoughts.
I would say that this is also a time of like when hospitals are panicking about, I can't worry about breast milk, I can't worry about things. Let us do our job. Like, use us as a part of the healthcare team. That's what we're here for. Don't push us aside and put us in another department. Don't say that, we have to go over here. Like, just let me do my job. And like, I can handle this. I can handle this breastfeeding mom right here. And this is where it comes like, well, last time on our last talk, we talked about advocacy and like getting out there. And we don't want to be insensitive to the issue of the fact that people are dying, but we do want to be sensitive to the fact that breast milk is medicine, and that we are trying to prevent death, because we actually don't know what's going on with these babies that are born to COVID positive moms. But what I do know for a fact is that breast milk holds antibodies, and I need this baby to get this. It's like necrotizing enterocolitis. Like, we know that can happen, and we know that those babies need breast milk. So let's not forget our common sense. Let's not forget the foundation knowledge that we know for a fact. We know that these people that are COVID positive, that they can't breathe, and we know that albuterol helps. So there are certain things that we just know happens, and I think we're ignoring some of those things just for the sake of, oh, well, this is just easier. Well, it may be for this moment, but I'm talking about health ramifications, like later on, what could happen. What we're seeing here in New Orleans and in LA, I saw the statistics. I haven't seen Philly, but I know Chicago and all those other places, Blacks, 70%. The COVID is killing 70%. Black people are at a much higher rate of dying, and they're putting it so much on, health disparities and all these things. And I know for a fact, Louisiana is number 49th in breastfeeding. We can only go down one more. But I know for a fact that this is going to have an effect on our breastfeeding rates. But this is going to give us so much more ammunition and go back and say, you know what? In the event we have another situation like that, let me give you some information. We about to have a whole little conference, staff meeting, grand rounds, or whatever about this, so we can really be prepared for this. Because I think, and we're not blaming people, but we just say, let's be proactive this time. Like, after this is over, let's talk about how breast milk and how lactation can fully be a part of the healthcare team. Because I felt, we were kind of stuck a little bit. So using this time to say, like, I'm here, use me, and let's not forget what we've been doing this entire time.
Mm-hmm.
Yes. Anything else, Angela?
Well, someone has asked, who's mentioned that, and many of the people who are more sick and who have some of those comorbidities because they were not breastfed when they were infants and babies. It's like, we all know that this is going to be a long-lasting effect. And someone just posted in the chat, thank you so much, that they are tearful and grateful for the words that you're providing to people today. So if y'all want to talk a little bit more, and I'll take a look. There is one or two more questions here, but let me take a look at them, and then please come back to me.
Yeah. Listen, we're all we got right now.
Right.
Yeah.
In terms of those of us who really get this, and that's isolating in itself. Like, we often counsel families that sometimes being the only breastfeeding person that is really an isolating experience. And go out and find your community, find others who are having this on this same journey. That's kind of how it feels to be a lactation supporter right now. It's kind of isolating, especially if you're working with an institution where it's not really being held up in the way that it should be. Please rely on your community. Find other lactation consultants, supporters that are having this experience that you can bounce things off of, vent to, whatever you need to do to make sure that you are not experiencing this alone. Jabina talked about a lot of us coming into this with our own challenges in mental health and our own anxiety, our own, some of us are lightweight hypochondriacs. And so any little tickle in my throat, I'm like, oh God, it's upon me. You know what I mean? So
it's Rona. It's Rona.
It's Rona. So it helps to be able to, laugh at myself and bounce some of this off of you all and really feel like I'm not alone in this thing. I saw something really, really cool. Nikki, I think you saw it too on social media. One of our colleagues created a playlist of all the best songs to just kind of encourage herself through this. That's a great way. I'd love to just have a soundtrack with me all day to just continue to keep me in a positive, uplifted place. So if that's what you need, to have your headphones on in the workplace setting and just continue to just jam out. If you need to, do that. Whatever works. To breathe, essential oils on your mask to inhale some positivity. Whatever works. Do that thing.
Yeah, for sure.
Yeah, I definitely agree. It's really just finding that place. I think especially while you're in the hospital setting is with your coworkers, because again, you guys are all having very similar experiences. And so I did read, I think from my hospital, they still want folks to social distance. So like not meeting in the break room. And if you are in the break room, that everyone should be about 6 feet apart from each other in the break room. Right. And so really talking with your managers and your team about how do you guys make this a place that you're able to kind of detach when you need to. You know, take a deep breath and get some fresh air wherever that might be during your day. Trying to find these small pauses, especially on L&D where it's very busy. Maybe a tap-in station, you know, or something like that. Because if you're experiencing this, there's someone else, you know, on the unit having very similar experiences. So, you know, maybe a tap-in where you tap in, somebody taps out, like, you know, really making this a community effort to support one another.
I think that's fantastic. Thank you for sharing that. Yeah, so you know, there's tons of ways to just pour back into yourself here and there. You know, we started at the top saying, you know, unplug if you need to. It's okay, you have permission. But if you cannot unplug, find other ways to just take care of you. Take care of you. Angela's got something else for us.
Hi, I do. So there is someone in the chat who became a certified breastfeeding specialist 2 weeks ago. And of course, now trying to get trying to get an internship though is a bit challenging. But they want to know, what can they do to support these families? They're ready to go and they want to offer that support. What can they do?
There's so much. I feel like there's a lot of stuff that you can do. Oh, go ahead.
No, go ahead. Go ahead.
There's you know, virtual services. Obviously, you can just being like, some people think they're like, oh, I'm not qualified to do virtual services. Have you ever texted anyone about their mastitis? Like, have you ever texted anyone about a plug duct? Have you ever had somebody said, I'm not making enough bill? You've done telehealth. It's just as simple as that, just being available. And there's, you know, Facebook Live. There's reaching out to your WIC office. Maybe they're short staff. I know our WIC office is, and they're like, hey, put me on as a peer counselor. Like, I mean, people are really getting into these roles quick, right? So at least in our space that we are, because we have a lot of people that are out because of their COVID positive. So that could be a way of tapping into your local and state services that you have there. They're like, hey, where can you use me? And contacting the hospital lactation department and say, hey, I'm available if anyone, like to our person that was having the calls in the middle of the night, hey, I'm available to help, you know, with some issues. And if you run into a sticky point, then, you know, refer it out to some IBCLCs in your community. But I want you to feel encouraged that any amount of help is helping, just being available to parents. If you have a local mom group that, because we have, it's called New Orleans Moms, we have Lafayette Moms, we have Baton Rouge Moms, and reaching out to them and say, hey, I'm available in the community if anyone has any breastfeeding help. So just, it's going to be more this time of reaching out. It's not going to be as much as people coming to you and saying, hey, what are you doing? What are you doing? You have to kind of take that step and go to the people and saying, hey, use me.
I think this is a really good time to.
Great advice.
Go ahead.
So I was going to say great advice. I was going to say that, especially if you're looking for hours or looking, you know, for mentorship, this is your time to kind of put yourself out there, to say, hey, you know, I have these skill sets. This is what I'm able to do within X amount of time, you know, hours, things like that. And reaching out to other lactation consultants in your area and offering a hand to support them and whatever that might look like for them as well.
I would agree. I think this is a great time, if you have the energy, if you're up for it, to really be unique in the way that you approach supporting families. And so if you've got a social media following, if you know, are pretty good at making graphics, you know what I mean? There's some really basic breastfeeding information that the general public is just not aware of. So some of that great information you just got, still fresh for you, make it into some powerful memes, push it out there. Can you breastfeed during COVID? Yes. You know what I mean? A few bullet points. Start to push out great evidence-based information into your community in a way that isn't being done. And I promise you it will be well received and appreciated by families you may never even hear from that are just at home like, what do I do? I don't know. Oh, this person says I can still. This person says this is how I get a good latch. You know what I mean? Push out great information. I think that's just one of a million different ways. Figure out what your strong suit is. Figure out ways that you can reach your community right now in a way that others aren't, and fill that niche, fill the hole. We all are needed right now. After you make sure you're okay.
Right. Tag your local WIC offices or your Healthy Start offices and things like that, because I promise you, they probably aren't. That's the last thing they're thinking about right now is a meme. Like they're probably inundated with stuff like that, and you can be of service to someone. So tag your local hospitals and things like that, using evidence-based information and putting it out there and tagging as many folks as you can.
Yeah.
One quick comment. Some parents are reluctant to accept a virtual visit. They think they need an in-person visit. Any words of wisdom to encourage them to trust and give a virtual consult a try?
Yeah, I actually have
the
a
raw version or the I was gonna say, do you want the raw answer or you want the look, this all we got?
Up to y'all.
This is all we got. We got to use
this is
it.
what we have to get right now. Is virtual support. So here's the thing I would say, and I wanted to say to that family yesterday that was in such distress and didn't want another virtual consult. Not all virtual consults are the same. Not all are created equal. Nikki and I talked about in our very first Q&A regarding telehealth that there's a skill involved. There is some really intentional use of language, use of props, and all sorts of things that those of us who have experience in doing this pre-coronavirus, pre-COVID, know to do when we offer virtual consult. So I would encourage families to give it a shot with a different practitioner. Give it one more chance. Let's see if we can't get you over this hump. Let's see if you send me a video and I send you a video back. Maybe that's better than just trying to line things, whatever. Try and be creative and offer them different ways to still be supported virtually, because they may just not have had a great experience because the person supporting them didn't meet their needs in whatever way that was at the time. That's my thought.
Yeah. And I also think trying to find out from them the why, right? Because there are folks who are, sometimes just overly anxious, and they want, especially in that postpartum period, and they just feel like because we are so used to human connection and touch and like physically seeing people, even like our little people. My 5 does not minutes. And so that doesn't work for some people. Some people aren't auditory learners, and some people it doesn't mix well. But I think for those folks, it's really important to ask the why. What's making them anxious around this? What is going on that's making them feel like they need this in person? And also just reiterating the importance of the distance and that the safety of their babies and them are the most important right now. And really highlighting that. But I think if we get to the root of like their why, that will also kind of ease some of their angst as well.
Quite frankly, I could be a carrier right now, and I could come to your home and infect you and your baby. You could also do the same to me, and I could bring it home and infect my children. That's a risk we're not willing to take right now, but let's talk about ways that we can support you still. Let's talk about getting over this hump, whatever it be, and how we can get there. And if it's a thing I'm not good at, I'm happy to refer you. Hey, Nikki, can you hop on the line with this family? They're just, I'm just not speaking their language. Maybe you can be a better support to them.
And we've done that at our clinic, is that we've had more than one person on the line. We've had a student on the line. We've had the primary IBCLC, and then myself was on the line. I chimed in, and like I feel like that I kind of like that approach. That's the approach that we use in our clinic, that there's more than one lactation person in the room, so we can get different points of view. So that's been working. But at this point, and mind you, there are some people, like we said, hats off to the folks that can go do home visits. We will tap into you if that's the case. If that's what that person wants, we will call you and give them what they need. But at this moment, I am not able to do a home visit, and for me, it is an issue of I don't have capacity. I'm homeschooling 3 kids, and my partner's working, so that has to happen. There's no childcare here, but also the health and safety of your child is what's most important to me. And I know that I work with a population that carries a high risk of having COVID, and that's not something I'm willing to risk to give to your baby. Just I'm not willing to risk that your health and safety. So that's very important to me.
That's it. Any other questions, Angela? We just hit the hour mark, so it's okay if we're all out.
That's perfect. Someone just asked, though, how do I witness one of your televisits? So they're a hospital-based lactation consultant. You knew it.
Oh, funny.
Yeah, my consent form does not include making it viewable to the public. That's not a thing.
Mine doesn't either. It's just the folks that are in the practice. I think, and that's why we did not use Zoom at the beginning, and we cannot afford the HIPAA compliant Zoom because we don't do Zoom bombers to come into our visits. So that's something even though HIPAA has been lax, I still uphold it to the T. I'm not playing with it and people's health information. So yeah, but we can. We produced some information, LER, the tip sheets, and if you want to have an outside conversation, then we can talk about. We can have a mock telehealth visit.
I was just thinking about that.
Yeah.
Well,
I would like to ask sorry, you have one more, Angela?
Just one more quick idea on that piece, and that is that if another lactation consultant says, I don't know how to do this, I want to support this family, I don't know how to do it, can you come along with me? Or can you do the visit with me? So in other words, they've already built the relationship with the family, and as long as they're willing to be flexible and assume that they're talking to the parent and saying, I need to call somebody else in here, then indeed the parent may be willing and open to having 2 brains and 2 supporters there. So
Absolutely.
Thank you.
That's a great collaborative idea.
I would ask those of you viewers or listeners who are still on the line, if you have a request for what topic we can handle next week. We are taking requests and suggestions for any future Q&A sessions here, so that we can make sure that we are meeting the needs as they are currently. So please go ahead and type those into the chat, and Angela will let us know what you all want from us in the future. Any parting thoughts, Nikki and Jabina?
For me, I think just leaving with you all that you have to take care of yourself before you can take care of the community. And at times when we feel like it's hard for us to do that because we do take our jobs very seriously, it's important to realize how important you are in this entire pandemic, in this situation, and that you have to be healthy and well first in order for you to take care of anybody else. And it might feel selfish for others, for some, but really, I give you all permission to do it. And I don't know how much weight I hold, but I really want to give you all permission to just be kind to yourself, be gracious, move with grace throughout this entire process, and know that it's okay to kind of step back. And it doesn't have to be 2 weeks. It could be a day. It could be 2 days. Take the time that you need to move through this.
I think I would like to leave y'all with the phrase that my therapist has been telling me for every week since it started. You are doing the best you can. And that is all that you can do right now. We can't change anything. There are literally 3 days of the week: yesterday, today, and tomorrow. That is all we know. That is all we know. And so, because the fact that I see that it's Wednesday because I know I'm supposed to be on this call on Wednesday. But outside of that, I know nothing else. So we are doing the absolute best that we can do. And that means something. That is worth its weight in gold, really, during this time. So I leave you with that.
I appreciate that. I would say I'd like to leave you just with the thought to be encouraged. Take your time to make this Wonder Woman Wednesday, Superman Monday, Invincible Individual Thursday, whatever. Take a day to, right, to just pause and make sure that you're okay. You got to make sure that you're okay. Also, I challenge you to share this with someone else. So interestingly enough, we've had wonderful, resounding feedback and attendance at these calls. This is the lowest attendance one, and I think I have an inkling why, because we don't want to pause to take care of ourselves. So I would ask you to share, push this on somebody who really needs to take better care of themselves right now, who didn't prioritize tuning in and listening today because they thought they didn't have the time or the space or the spoons. To learn how to take care of themselves while they're so busy taking care of other families. So share the love. Say, hey, I know that you're really busy. Listen to this, in the background while you're doing something. I think there's some nuggets in here that really may help you to just refill your cup a little bit in the middle of all of this. We thank you for listening. We thank you for sharing. We thank you for being present. And we are still taking suggestions. If you want to reach out and let us know anything you'd like to hear in a future Q&A, we'll be right here for you. Thank you, Javina, for joining us with your wisdom.
Thank you, Javina.
You're welcome.
Expertise. We appreciate
We
you.
appreciate y'all.
Y'all check her out. Check her out on all her social media. And we'll see you again next week.
All right.
Bye, everyone.